inpatient and an outpatient at Hinchingbrooke Hospital. The main illness I suffer with is called Ehlers Danlos Syndrome, and it's a connective tissue disorder that is genetic, and I was born with it. It causes my collagen to be faulty, and it makes me extra stretchy and prone to injury, but it also affects all of my internal organs. Imagine your connective tissue being made of elastic bands. This is basically how my body is constructed inside. Ehlers Danlos Syndrome, or EDS for short, has affected me in many ways, including putting me in this wheelchair. I'm in this wheelchair for two reasons. One is because I get numbness in my legs on standing and have a lot of pain due to the Ehlers Danlos Syndrome. And I also have a condition called POTS, short for Postural Orthostatic Tachycardia Syndrome. This affects me in many ways, including dehydration, nausea, low blood pressure, palpitations, dizziness, heat intolerance, poor circulation, migraines, and the list goes on and on. Therefore, I cannot stand for more than about 2 or 3 minutes without fainting. Ehlers Danlos Syndrome is diagnosed by visual diagnosis using the Baton scale, and also having a blood test to eliminate the vascular type, which is life-threatening. Symptoms of EDS are easy bruising, stretchy skin, stomach issues, growing pains, poor handwriting, dislocations and subluxations of joints, easy tearing of muscles, ligaments and connective tissue. And there is also an issue with the healing of the skin, so sometimes surgery has to be carefully considered because of the healing process and the damage that can be done during surgery to the very fragile connective tissue. Treatment for EDS is usually pain management, physiotherapy and pain relief. Unfortunately, there is no cure at the moment for type 3 hypermobility type, which is what I have, and scientists cannot find a faulty gene in the testing. So far, EDS has caused me to develop anemia, costochondritis, spondylolisthesis, which is an issue with my spine, vitamin B12 and D deficiencies, gastroparesis, which is where your stomach doesn't process very easily, bladder issues, gastroesophageal reflux disease, and mast cell activation. And that's so far. However, I have been to hospital, which is very regularly as a patient with my EDS, and have always found the treatment has been very difficult to get. You may be thinking that you have never heard of EDS, and you may be right, but EDS is one of the most misdiagnosed diseases in the world at the moment. In the last year, statistics have gone from 1 in 1,000 patients to 1 in 30. So it's not a rare disease, just very misdiagnosed. It can be complicated and misdiagnosed as arthritis, osteoporosis, and many other connective tissue related diseases. There are many types of EDS, vascular type being life-threatening, but the rest is very life-limiting. In type 3, the hypermobility type, I rely on my wheelchair and lots of different specialists and physios to help me get through each day at a time. It has meant that I have to stop working. I moved back from London and stopped enjoying my life in my mid-20s. Luckily, I have a happy life now, although I experience severe pain on a daily basis. As an outpatient, I've been to A&E many times, and it's only recently that I've been taken seriously about EDS. It was only in the last few weeks that I saw a doctor here in A&E who had looked up EDS but admitted he knew nothing about it. For me, it is very frustrating, as all you have to do simply is Google Ehlers Danlos Syndrome, and there are thousands and thousands of pages that come up with information, both medical and in layman's terms for the general public. I have been misdiagnosed most often and sent home with painkillers which never really work. And the worst is when I'm not taken seriously or believed that I have this condition. The main problems that I have had in A&E is difficulty to get a cannula into me, as I have very deep veins due to my EDS. Also, I become very dehydrated and often need IV fluids. I also have problems absorbing medication, so it is very normal and common for me to have medication via IV access. Most doctors don't believe that and continue to give me orally medication, therefore the tablets do not work, or they have to take a very long time to absorb into my body. Also in A&E, the amount of times I've come in with injuries that I know are bad, but I'm always given an x-ray, and it's often a waste of time because I can feel the difference between muscle and bone injury. In the last few weeks, I've recently dislocated my shoulder, which is a pretty much a daily occurrence, and I relocated this myself at home. and I came into A&E and it was fairly uncomfortable. I had an x-ray and was told that it wasn't dislocated, which I knew, but they told me that I would need physio and to move my shoulder around so it didn't stiffen up. However, I did move my shoulder around, and 2 days later I was back in A&E, and basically I couldn't move my arm at all without severe pain. I got re-x-rayed, and this time they actually found a calcium lump on my tendon in my shoulder, which had been there for some time, and this was missed in the previous A&E trip. Then when I visited the fracture clinic and saw the orthopaedic doctor, he said to keep my arm in a sling for 2 weeks and see an orthopaedic doctor at Addenbrooke's who specialises in shoulder treatment. However, he cannot refer me currently directly to Addenbrooke's and said that my GP should do this. However, yesterday I visited my GP and my GP said he cannot refer me directly to an orthopaedic doctor either. So he now has to refer me to a rheumatologist at Addenbrooke's, and then the rheumatologist has to refer me to an orthopaedic surgeon or doctor, which seems absolutely crazy because it's not only a waste of time for some of the departments, but also a waste of money and a waste of time for me, and also extreme pain for me, which is drawn out much longer than it should be. Doing damage to my shoulder is nothing new. I've done very bad damage to my tissues, muscles and ligaments in the past, and usually x-rays don't show anything, especially if it's muscle, ligament or tissue damage. So it'd be so much easier if something like an ultrasound or a scan was available for patients with EDS in the A&E department. I am also under a specialist here for urogynae specialists, and she knows a lot about Ehlers Danlos Syndrome and how it affects my bladder. She is a wonderful doctor, and she has actually done extra research just because I'm a fairly unusual patient. They have tried me on different treatments, and I'm pleased to say that we've finally found something that we think is working. I've also had excellent treatment by the outpatient physiotherapy department here, especially Carol, my physiotherapist, as she has good knowledge of EDS and joint hypermobility, and has given me exercises which will strengthen me and not damage my very fragile connective tissue. The main issue in some cases is that physiotherapists have not heard of EDS, and they can give exercises which can really damage somebody with EDS, and this is quite dangerous. As an inpatient, I have only been at Hinchingbrooke on one occasion, luckily. I was in 2014 for suspected meningitis, but it turned out that it wasn't, and that I had an infection, a slipped disc and pain in my neck and upper spine. Firstly, I would like to start with the positives, that the nurses were wonderful, and one particular student nurse took a real interest in both my EDS and my POTS, because when I stand up, my blood pressure drops and my pulse increases quite significantly, which is far from normal, but the nurse was fascinated by this, especially on doing OBS. As a patient, this is what you want to hear. You do not want a doctor or a nurse to dismiss your condition, or at least they can come back to you later and say they've looked it up and therefore they are fascinated. The main thing I find being an inpatient with EDS is that you are often treated like you're a bit stupid, and sometimes the doctors do not like to think that you know more about your condition than they do. It would be very useful if they could genuinely listen to you, go away and research what is wrong, or even just contact my specialist in London or the EDS UK charity, and then come back to me with a better knowledge. I have some examples of the treatment I received when I was an inpatient in 2014 that didn't go so well. On one occasion, I was told that I would need a lumbar puncture, but knowing that in EDS, local anaesthetic is very hard to get to work, and you have to put a lot of local anaesthetic in because it drains away very quickly and the muscles and tissues will absorb the anaesthetic too fast. Luckily, I had an information leaflet with me about surgery and local anaesthetic, as I'm always prepared when I come into hospital because I know that usually no one's going to understand what's wrong with me. The anaesthetist and surgeon went away, read this, and then came back to me and told me they would definitely not be doing a lumbar puncture, having read the information. It's a good job that I have a sane mind and am able to communicate this to them, otherwise they could have done severe damage to my nerves in my spine. On another occasion, I slept in an awkward position during the night, which is very common for me, as my joints are super bendy. I had dislocated my knee, which when turning over, I managed to relocate. The pain is excruciating, but the nurse who was on that night kept telling me to be quiet as I was disturbing other patients because of my screaming. I'm not the kind of person that likes to disturb other patients and was extremely distressed, and nobody made any effort to calm me down or understand the amount of pain I was in. It took a very long time for a doctor to come and assess me, and when she did, they took me down to X-ray yet again. Of course, I felt my knee go back in when they turned me over, and when I went down to X-ray, the radiographer was very rude, telling me to be quiet, and when they saw it wasn't dislocated, they insinuated that I was making it up for attention. Believe you me, you can never make up a dislocation because it is excruciating. The following morning, the doctor came round and I explained what had happened the night before. All they did at the time was to ask the nurse to secure the bandage around my knee. However, the nurse came with a crepe bandage and very loosely wrapped my knee, and that was it. Later on that day, a different doctor came back and was appalled to see what was on my knee. So I had to ask my fiancé to go home and get one of my knee braces and bring it to the hospital, which he shouldn't have had to do. And we also eventually managed to get ice to put on it, which was about 12 hours later. Another occasion was just in general, that I would see a different doctor every day, and it led me to complain to the PALS department. This is because of the nature of my unusual condition. Eventually, they got involved along with the ward manager, and I ended up seeing the same doctor every day for my last 5 days in hospital. I was in hospital for a total of 3 weeks. This was completely unnecessary. Most of the time I was stuck in hospital because of weekends in which the doctor never got to come round to see if I could have been discharged. The surgeon I had under my care didn't really seem to know what was wrong, and I had to insist on having an MRI on my spine, and that showed that I had a slipped disc. He then saw me in his outpatient clinic here, but repeatedly saw me every few months, to which there was no change in my condition, and eventually I got referred to Nottingham, which was a disaster as they didn't know what to do either. The conclusion to that was that I had to get my GP to send me a new referral down to London, where all my specialists are, and it is only recently that I've got the results of 5 MRIs that I've had to see the state of my spine. It's in a much worse condition than it should be, as it's been well over a year, and I should have been treated within the first few months. The final issue I had to being an inpatient was with the physios I saw on the ward. My EDS was not understood, and it is very important to me to mobilise every day to stop me becoming deconditioned. When I'm at home, I walk around my bungalow unaided, and when outside, I either use a crutch for short distances or my powered wheelchair for further distances or for sitting for long periods. The physios came to see me after 2 weeks of me being in hospital. They got me out of bed and saw that I could walk to the toilet with the aid of my stick. Because I could walk that short distance, they said I was fine and didn't need any help. I did try to tell them that I needed further physio, but they got quite angry at me and said they couldn't see me anymore as there was nothing that they could do. I was very distressed about this, as they hadn't listened again. My condition was dismissed. It only takes a few minutes to look up Ehlers Danlos Syndrome, and I wish this was done more often. I would like to educate you here today about Ehlers Danlos Syndrome because I will be a frequent visitor to Hinchingbrooke Hospital with my condition. It is important for doctors, nurses, HCAs and physios to understand the syndrome, and there needs to be much more awareness in the near future, as you will find a massive increase in patients. For example, I know of 7 patients all living within the Huntingdon area, all who have EDS and POTS, and I'm sure they will make a visit to this hospital at some point, either as an emergency or as an outpatient. I'd like to thank you for listening to me today, and I hope you can take away some knowledge of Ehlers Danlos Syndrome, and I hope that the incidences that I have described can improve care in the future for all patients. Thank you.
Thank you.
Yes, I mean, Liz, thank you so much for having the courage and taking the time to come and speak to us. And I mean, I think we'll be working with Liz going forward as a board and as a service provision to help us learn from the experiences you've had to improve services for patients going forward.
Anything else?